Dr. Bender.
Yes.
I
Yes, Ms.
was
Roy.
just wondering, yes, but what do we have a quorum? How many persons do we have? Representatives from where? I'm just seeing a few, so maybe you should do I will just maybe introduce you and then you do the roll call and see who's there, and then that will give us some time to wait.
Yes, thank you, Ms. Royal.
Okay, so good morning, colleagues, and welcome to this third HRH meeting. I am Mrs. Ellen Roy, and I'm the Director for Human Development, under which this program falls. So let me first take an opportunity to welcome our new Deputy Program Manager in the person of Dr. Serena Bender-Pelswick. I hope I am pronouncing it well. She just joined our crew, and I'm sure that she doesn't feel any new. I think she is behaving and going around like she's been there with us for a while. So I am aware that she's going to do a fantastic job with you on HRH, and I want us to officially welcome her. She will work together with the chair on coordinating and executing this meeting. So at this time, I will ask Dr. Bender to maybe ascertain who is present while we wait for the others to join in.
Well, thank you, Ms. Royal. And again, my name is Dr. Serena Bender-Pelswick, and I'm happy to be here at CARICOM. And so I hope that over the time that I'm here, I'll be able to meet all of you, and I'm sure we'll become acquainted soon. So as Ms. Royal pointed out, I just want to take the time to do a quick roll call to see who is here. And so I'll begin with the country delegates, and I'll start with Antigua and Barbuda. Can anyone say if there's a representative from Antigua, Barbuda? I don't see anyone listed. I think we had Miss Margaret Smith listed, but I don't see her in. So I'll move on to the Bahamas. Okay, that was Miss Clarita Moxie, but I don't see her here as well as yet. So we might have to give her a few more minutes. Regrets were extended from Barbados as they had a competing event, so they would not be able to join us today. Belize. I see Miss Lisbeth Bell had confirmed her attendance. I think we can probably give her a few more minutes to join us. She was supposed to have been the chair for this morning's meeting. So we'll move on next to Dominica.
Florestine Lewis, Dominica, present.
Thank you so much, Ms. Lewis. And then we move on now to Grenada.
Good morning, Mr. Edwards, Grenada, present.
Thank you so much. Guyana.
Good morning, everyone. Claire Chung here from Guyana, and I just want to say welcome and congratulations to you, Miss Bender, on your new appointment.
Thank you so much.
Yeah.
Therefore, we move on to Jamaica. Okay, they had not confirmed their attendance, so we will hold on, I suppose, to see if they will arrive. Montserrat. Okay, we have not gotten any feedback from Montserrat as well. So we move on to St. Kitts and Nevis. Okay, we move on. St. Lucia, sorry. Do we have any attendance from St. Lucia? No, it does not appear so. I'm sorry, they did offer their regrets as they had a competing event, so they were not able to attend. So we move on now to St. Vincent and the Grenadines. Okay, so that's no. It appears that we don't have anyone here from St. Vincent and the Grenadines. Suriname offered their regrets. They were not able to join this morning as they had another event. Trinidad and Tobago. Anyone from Trinidad and Tobago? No? Okay. We move on to British Virgin Islands. All right. I think Ms. Hyacinth Hannibal had been the person who had been identified, but it did not confirm. So next, Turk and Caicos Islands. Ms. Sutton. Okay, I don't see Ms. Sutton on the line, so it appears we don't have anyone from British Virgin Islands, nor Turks and Caicos Islands. I see there are persons from CARFA.
Hello, good morning, colleagues. Patricia Smith Cummings, Caribbean Public Health Agency. Happy to be
Thank
here.
you so much. Thank you so much. Well, we appreciate our colleagues from PAHO WHO are here. I take note of Dr. Puertas and
Good morning to everyone. Good morning, Dr. Bender.
good morning.
Good morning,
So-
Dr. Brenda. Cecilia Cuña here from PAHO WHO.
Thank you so much. Is there anyone else we'd like to welcome from PAHO then?
Giselle Almeida here from PAHO, Washington. Thank you. Good
Thank
morning.
you.
Good morning to everyone. Fiona Glanville from PAHO.
Thank you so much. And so we move on to Dalhousie University. I see we do have two representatives here.
Good morning.
Good morning, good morning.
Yes, Gail Tomlin Murphy, and thank you so much for this opportunity.
Okay.
I think Janet Rigby. I think Janet Rigby, are you on?
Yes, I did see her in the.
Good morning.
Good morning. So we move on to University of West Indies. I did notice Professor Julie Meeks.
Good morning.
Thank you so much. University of Guyana, I think Dr. Cummins would have been the person who indicated they would represent today. Dr. Cummins, are you online? Okay. And from the regional nursing body, do we have anyone here from the regional nursing body? I believe it was supposed to have been Miss Gina Dean. All right. All right, and I think the World Health Organization, do we have anyone here from the World Health Organization? All right, and then, well, from the Secretariat, there is Ms. Soraya, the Director of the Human and Social Development Directorate, and myself, Deputy Program Manager for the Health Sector Development. And with us today as well would be Ms. Geeta Jailar, who is Secretary of. And do we have any other attendees outside of the persons or organizations that I just mentioned? All right. So Ms. Raya, just to point out, it appears from our member states, we only have one. I don't believe we may have a quorum. You can really guide me. I think we only have about 4 countries online at the moment, along with our partners.
Okay, thank you very much, Dr. Bender. I think this meeting is well represented by many stakeholders, and unlike the COSORD, where we would have to ensure that we have 8 representatives, I think it is clear that we should and could continue the meeting. What we need to do is when we are taking policy decisions, you would need to keep checking to see if we have a forum from member states, but we have a quite a wide range of stakeholders, and I think it is safe for us to go ahead with the meeting.
Okay, then thank you for that guidance, Ms. Royal. And so with that, I'll ask you to extend the welcome and opening remarks for our meeting today.
Thank you very much. Dr. Benjamin Priotas, Unit Chief, Human Resources for Health. Mr. Dean Chambly, Sub-Regional Program Director of the Caribbean. Dr. Serena Bender-Pelswick, Deputy Program Manager, Health Sector Development. Members of the Commission representing member states, partner agencies, and regional institutions. Good morning. Permit me to extend a warm welcome to you on behalf of the Secretary General of CARICOM, Dr. Carla Barnett, to the third meeting of the Caribbean Commission for Human Resources for Health. Your presence here today attests to your continued commitment and support to strengthening human resources for health in the region. It also signals your resolute commitment to the implementation of strategic action framework that aims to address existing and emerging challenges in ensuring the availability of an adequate and well-prepared workforce to provide quality health services for all people in the region. Recently, the World Health Organization declared that the COVID-19 pandemic is no longer a public health emergency. However, by no means is the pandemic over. Therefore, the work of the Commission to address the human resources priorities related to migration and vaccine hesitancy amongst healthcare workers in the context of the pandemic will continue. The opportunity now presents itself for the members of the Permanent Commission to consider and actively shape what will be the expanded strategic objectives of the Caribbean Commission for Human Resources for Health beyond the time of COVID-19. It must be remembered that human resources for health remains a key pillar for the operationalization of responsive and resilient health systems in the Caribbean. Furthermore, as guided by the 43rd COSOD, specific emphasis should be placed on the terms and conditions of service. Today's meeting will provide, among other matters, a recap of the agreed on actions for HRH emanating from the COSOD, update on implementation policy briefs, HRH strengthening, status of core HR indicators, selection for the logo, and importantly, vaccine hesitancy. Your deliberation and guidance on the policy decisions is of extreme importance in light of the mandate from the 29th Special COSOD held in the Bahamas on the 27th of April, 2023. At this time, I wish to recognize the continued partnership of the team at the Pan American Health Organization, the representatives from the partner organizations, institutions, and commissions who are also supporting this initiative through technical support. Special mention must be made of the Caribbean Public Health Agency, the University of the West Indies, the University of Guyana, the World Health Organization, Dalhousie University, and the Regional Nursing Body. Finally, I wish to acknowledge the focal points from member states who are strategically supporting the management of human resources for health and spearheading actions to address the challenges faced at the country level through data collection and implementation of recommended actions. Again, I wish to thank you for your continued partnership and commitment to this initiative, and most of all, for taking time from your busy schedule to attend this meeting. I wish you a successful meeting. Thank you.
Thank you for your remarks, Ms. Royal. At this time, according to the agenda, we should be looking to assume the chair. It is my understanding that Ms. Lizette Bell should have been the chair for this meeting this morning, but it does not appear that she's online at this time. So with Ms. Royal, with your permission, I don't know if you'd let me to chair the meeting in her absence.
Yes, I think I got a message that her dad, I think, died suddenly, and we have not been able to, reach her. So I think in the absence of the chair, you could go ahead with I think the able help of Fiona if there are items that PAHO has to deal with. I was told that Fiona would be the support. Is that so?
Yes, definitely. I'm here to support.
Okay. All right. Then. Thank you.
Thank you
Over
so
to you.
much. Thank you so much for that, Director. And so with that, I would move for us to adopt the agenda. And so just permit me to share so that we can all review what is on the agenda today. Please let me know when you can see the screen. Can everyone see the agenda?
I can see it. You could maybe zoom out a little, Dr. Bender.
All right. So on today's agenda, we do have first the adoption of the agenda. We'll then go briefly into the procedural matters of the meeting, followed by the update on the implementation on the policy briefs that the Commission have there, which are the HRH strengthening policy brief, as well as the vaccine hesitancy policy brief. Followed by that, we will go briefly into what were the mandates coming out of the HRH meeting, the COSAD mandates for the HRH, which would have been this last COSAD, the special COSAD 29th that was held in April, as well as a status of the implementation of the core HRH indicators, which will be done by our partners at the PAHO WHO. Followed by that, we'll go into what was the result of the selection of the logos for the HRH Commission. And then we will have an open discussion and any other business. And then we will finalize the meeting or close the meeting by setting the date for the next meeting. So at this time, I don't know if anyone would like to add or maybe make any adjustments to the agenda at this time. I open the floor for anyone who may want to comment on that.
Just one brief comment, if I may, Madam Chair. And that's that the opening remarks, we also had some, as PAHO, some opening remarks, but regarding the time, probably we could just continue. I would suggest that we move into the next agenda item.
Dr.
Okay.
Puertas? Dr. Puertas?
Yes, good
No,
morning.
I think no, we would need we will accede to you. I would want you to do the remarks from PAHO, which is the normal. I think that was an error. And as I said, Dr. Bender is new and I did not realize either. So
no problem.
Yes, I do wish to extend my apologies in that part, yes. And so at this time, I think perhaps, yes, it would be prudent for us to just backtrack a little and allow yourself, I assume, to make the remarks on behalf of PAHO WHO. I open the floor to you. Thank you.
Thank you very much, and really no worries about that, because basically what I want to say is hello to everyone. At this moment, I'm talking in behalf of PAHO, the Pan American Health Organization, and the Sub-Regional Program Director, Mr. Dean Chambliss, and very happy to participate in this third meeting of the Caribbean Commission. And I think we have very interesting developments and news and elements to discuss today. So what I see is that we're having a bright future for the Commission. We have some elements that are moving around our main topic, which is human resources for health at the regional and at the global level. And more, the Caribbean Commission is going to have a very, very important role in those developments, and we will be able to discuss some of them today. So again, very much thank you to all of you. And of course, as always, I'm very happy to be with the Caribbean colleagues once again. Over to you.
Thank you, Dr. Puertas. And again, our apologies. And so with that, I resume. I do extend again to the floor to determine if there will be any additions or are we going to adopt the agenda as is? Okay, I think I do wish to add at this point, I think as we well know, we are now a commission, and coming out of based on which we will certainly look at later on, coming out of the mandates, coming out of the last COSAD, as well as the fact that we are now transitioning out of the pandemic, the COVID-19 pandemic, there is some room for us to look at taking stock at where we are in terms of what we've been able to do since the task force was created in 2021, and how we move forward as a commission in the future, looking beyond COVID-19. So with that in mind, I'd perhaps would like to add under any other business what possibilities exist for discussion or open discussion surrounding what could potentially be the expanded mandate of the commission, as well as looking as to how we can further document what would have been the work of the commission up to this point. I don't know if there are any objections to that proposal.
Supporting the proposal.
Thank you so much. And with that, I would move so in that case, we'll add that to our agenda topic 10 for open discussion. And with that, I don't know if there are any other additions that we would like to make before we adopt the agenda. If there are none, well, I'll say we adopted the agenda. And in so doing, we'll move on to our next item. For the procedural matters, Ms. Roy, I don't know if you can offer some guidance there.
Okay, basically we have to indicate, thank you, Dr. Bender. We have to indicate the time frame at which we are expected to end this meeting. Normally, I think the meeting ends at 1. Is that so? What time are we intending to stop, Dr. Bender?
I believe it's within 1 hour, but I'd be so guided by Dr. Puertas. Do we have an extended meeting
1 hour?
time? Yeah.
I don't see 1 hour.
Dr. Puertas, can you provide
well, looking at the agenda, it might be a
The agenda
bit
is very
overload.
long.
Yeah.
Yeah,
The
a bit,
agenda looks like 2, so at least by 12 o'clock, if
yeah.
that is amenable to the delegates. And basically for those who are online, we always inform that you should indicate via the chat your name, designation, and the member state organization that you are representing. Also, if there is any question, there is a reaction button that you raise your hand to make an intervention. And it's open discussion on usually once the presentation is made, we open up for any interventions, commendations, whatever on the item. And if you're joining from outside and you're having any technical difficulties, we advise you to wait until we get back because sometimes we get caught up. So basically these are the main procedures unless PAHO or partners have any other matters.
At this time, PAHO, do you have any further guidance that you'd like to offer for the procedure of the meeting?
No, not really.
Okay, thank you so much. And with that, we move on to our next agenda item, which would be the update on the implementation of the policy briefs. I will stop sharing to allow our partners from PAHO WHO to go ahead and share if they would like.
Thank you very much, Madam Chair. I will do this initial report on the implementation of the policy actions, and then I will ask my colleagues who are with me today from PAHO to complement. I will have to jump out of the meeting for half an hour, as I already mentioned to you, since I need to join a WHO call, but then I'll be back. However, I would like to start with some of the main and very interesting elements that I mentioned to you during the opening remarks. The first one is that the catalytic fund for the capacity building initiative initiated by Minister Anthony Frank from Guyana which has a range for the Caribbean. It was approved and we'll be getting the first tranche of money in the next few weeks. And I want to point out that one of the part of that funding is going to go to support activities with the HRH Caribbean Commission. So that's going to be very important because we will be able to carry out actions to implement the previous policy actions as well as the new ones that we will discuss today. And we have some funding to support those activities. So that's very important. So that's something I wanted to mention. And regarding the implementation of the previous policy actions, there are some elements. We have been continue working with the HRH core indicators. And I will let Dr. Gisela Almeida and Ms. Fiona Glenville to provide some additional details on this. We have been training the Caribbean focal points on the National Health Workforce accounts. We are about to publish some of those analysis and reports that we work with in those days, the HRH Action Task Force and then the Caribbean Commission, including again the HRH core indicators that were worked with the Commission. We're also about to publish the mapping of academic and training programs in the Caribbean, which is another work that we did it as a commission or task force in those days. In terms of vaccine hesitancy, we had the first policy action was monitoring the this hesitancy and vaccine acceptance among healthcare workers in the Caribbean. So now we're about to launch a new analysis, a new study that involves not only the COVID-19 vaccination, but also other adult vaccinations. So we're in the stages of preparing the protocol, and then we'll share with the countries for them to provide any feedback. And I will suggest that the Caribbean Commission should receive a short presentation in the next meeting so they are aware of what we're expecting. But it's going to be something similar to the previous one, but again, adding additional questions on adult vaccination, not only COVID-19. And that's because we are seeing a change, and secondly, the importance of healthcare workers in influencing population in terms of getting or not the vaccines. That includes adult vaccination and also the childhood immunization as well. So that's going to be a very important part, and it will follow that particular policy action. We have continued with the strengthening on nursing education program. We recently, we had 3 pilot projects in Turks and Caicos, in Dominica and Belize. And just a couple of weeks ago, we received the simulation lab equipment. As you will remember, that was part of the second component. The strengthening education program included a review of the curriculum, and the second component was the strengthening of the simulation labs. So we already provided of the equipment required by the School of Nursing in Belize, and that has been delivered. And now we already started the training of nursing mentors with the same country, with Belize. So in this particular case, we completed the site visit early this year, and the recommendations and the report was presented to the university as well as the MOH in Belize. They provided some feedback. And recently we started the training of nursing mentors, which is we're very happy. And we have the same collaborating center, PAHO WHO collaborating center, doing this. And this is the School of Nursing at University of North Carolina at Chapel Hill. So we still need to do the site visit to Dominica. With Turks and Caicos, we have completed all the stages, including the analysis of the nursing program and the delivery of equipment for the lab, simulation lab. And it's very interesting because, we keep moving and now we are in the phase of opening up to other countries, and that includes Barbados. I will ask Fiona Glenville to provide more information on the Barbados program about the nursing education. So I think we're moving in the right direction. We have still some elements that we haven't completed, and we have some information from the countries that hasn't been provided in full. So what I would suggest is that countries continue providing support for the implementation of these policy actions. Without your participation and as official delegates, we cannot really move forward, and that's what it's really needed. So I'm going to stop at this moment and ask Ms. Fiona Glenville and Dr. Giselle Almeida to complement to what I just said, and if I missed something, I would appreciate if they continue. And as I said, I will have to jump for a few minutes because I'm already late for the other meeting. I'll be back in about 25 minutes. Thank you very much.
Thank you, Dr. Puertas. While I do acknowledge the raised hand of Ms. Florestine Lewis, perhaps we can hear the completion of the update before I take that comment or question. Thank you.
Okay, thank you, Dr. Puertas, and thank you, Madam Chair. I just want to add with reference to the work that we're doing in Barbados. The University of Michigan worked with that's one of our PAHO WHO collaborating center, worked with the Barbados Community College to train the facility in the use of simulation during teaching. And I think that this is a very important initiative that we can extend to other members of the Caribbean Commission, other member states, as it gives an opportunity to be able to build capacity, particularly in the area of nursing. So it allows for nurses to be able to learn in a simulation environment before going out onto the field, and make them more prepared for working out in the field. We also had the University of North Carolina doing something similar with the University of Belize. So these are some of the initiatives that we've taken to help to develop capacity, particularly in the area of nursing. From the virtual campus, I want to present that we have a lot of opportunities, and it is a resource that we can use to be able to build capacity within the Caribbean region. It is an opportunity for us to develop courses that are specific to the Caribbean region. So one of the things that we've identified is the need for developing capacity among nursing lecturers, because many of the Caribbean countries will indicate that they have that challenge with nursing lecturers. So we've already started discussion in how we can do a virtual course online for nursing lecturers, and this will soon be developed. So we have resources that we can use, including the virtual campus. It's available. We have our Caribbean node that we would like to encourage people to take advantage of. Tell us what courses are needed and help work with PAHO to develop the particular courses that are needed for the Caribbean region that will help develop capacity and support the actions of the policy brief that we are implementing. Thank you. I hand over to Dr. Maida.
Thank you very much, Fiona. I have a quick presentation regarding the status of the priority actions and the priority table that we did last time. Do we have time for a quick presentation?
Yes, I believe we do. So you can go ahead.
Can you see my screen? Can you all see it?
Yes, we can. At least I can.
Okay, I apologize for those who have seen this presentation before, but since we have some new people aboard, I would like to go over quickly over what we have been doing with the HRH Commission, Caribbean Commission. So we established a work group and following the fourth meeting of the HRH Action Task Force. And the working group was defined to discuss indicators in the region. And with that, there were a set of proposed indicators, and of which 32 were selected consensually by all of the working group members, which are here at the table to your right. I'm not going to go in specifics because I know some of you have seen this presentation before. So we had a workshop. The National Health Workforce Account was chosen by the HRH Action Task Force as the tool to collect data. And the use of the platform allows the country to report on standardized indicators and allow the countries to improve the availability, quality, and use of data to improve their health workforce. As I mentioned, so the National Health Workforce Account is a tool. It's not an information systems for the country, but a tool that the countries can progressively use to improve the data that they have in health workforce and the evidence that they need to progressively monitor human resources for health indicators, which is very important. So the National Health Workforce Account uses the framework of the health labor market, which was developed by the IOM, IOL, the International Labor
Organization. Yeah.
And it uses information from the education sector, and it has different modules for the education sector, and also from the labor market, with also with different modules for those information and indicators, and also has also module that it's specifically for the population health needs. So it's very similar what we use in the National Health Workforce Account. Just to go over the occupations that have been defined as the most important right now to enter information in the National Health Workforce Account: physicians, nurses, midwives, dentists, pharmacists, and community health workers. These were defined as the major professionals to start populating data at for the National Health Workforce Accounts. Now, we have the definition we have the definition of health occupations as part of the manual that you have for the National Health Workforce Account. And you can, if you can notice that we have a lot more occupations there, but we decided to focus initially in that. Actually, most countries focus on the first two, physicians and nurses, and just for that, it's sometimes difficult and presents a lot of problem with accessing the data, because the data for human resources for health doesn't come only from the health sector. It comes from education sector, comes from the labor sector. So it is it may be quite a challenge sometimes to populate the National Health Workforce Account with information, but it is an excellent tool for the countries to understand their information needs and to have a plan to develop their human resources for health information systems, because it gives you the basic indicators and the basic data set that it's going to be needed for any further monitoring and evaluation and planning on human resources for health. Now, these are the core indicators and the supplementary indicators selected by the Commission 13 basic indicators on level 1, 16 supplementary indicator on level 2, and 3 supplementary indicator in level 3. And here they are. I'm not going to go over each one of them. We can share this presentation with you, but also, as Dr. Puertas mentioned, the document on the core indicators are almost ready, and you will be able to have that with you shortly, the official document with all indicators. Now here, just a summary of how how countries are entering data and what is the status of the data collection in the region. You can see those in green, those boxes in green represent countries that have entered data on the last tranche of data collection for the National Health Workforce Account. These are countries that usually have a focal point from the Ministry of Health, also a focal point from PAHO, supporting them in this area. Those countries in yellow are the countries that have submitted data for the 2017-2018 biennium, but has not updated data from the 2019-21. Now, I apologize ahead of time because at a meeting yesterday with the information systems group at PAHO, I was told that some countries have updated their information. So this table is not up to date, but there is only 1 or 2 countries that have updated the information from Human Resources for Health in the past 2 weeks. And the countries in red are the countries that have no data. And I would very much like to work with these countries and see how we can move forward in collecting data for them. And the list of the countries, not only you can see in the box, but it's also here to the right corner. You can see the list of all the countries that have not submitted any data to the platform yet. Excuse me. So this table represents the information that has been entered in the platform for the last tranche of data, 2019-2021, which countries have submitted data, what type of data they have submitted, and the level of completeness of data. And if you want to quickly see the Caribbean region, just look at the salmon color, like the pinkish salmon color here. Suriname, Trinidad and Tobago, and Bahamas have submitted data on physicians, stock, which is the total number of physicians, gender, age, also health facility ownership. So, but there is a level of completeness of about 44% for these 2 countries. So they still need to complete the data. The ideal is to have information from all of the columns that you see here. That's the ideal situation. So that's when we see 100% completeness. And here is another table for the nurses. Again, look at the Caribbean region and you can see the salmon color. You can see those that have entered information for the nurses, Antigua and Barbuda, Trinidad and Tobago, Guyana and Suriname, but it's still a lot of information missing in terms of gender, age, place of birth, and the other variables that we also try to get information that helps with HRH planning in the region. Just to mention that, and PAHO, the CARICOM, and the Regional Statistics Program started the discussion in a meeting a couple of weeks ago on how to move forward with the implementation of the core indicators and actions to improve not only human resources for health information, but also human resources for health information systems and planning. And I would like that everybody could see the big picture of what we are trying to do here is to improve the health in the region, right? To improve health in the region, we need to improve the situation of human resources for health. We need the right skills mix, the right number of professionals available for our systems in the region. And that's the purpose of collecting information and having ownership of this information and working towards a well-developed HRH information systems. That's the main purpose. So during that meeting, we decided that the goal was to strengthen evidence-informed decision-making and policy development on HRH in the Caribbean. The specific objectives are right there: to improve data collection, analysis, and reporting of the HRH core indicators for the Caribbean, and to strengthen and sustain the availability and use of strategic information for human resources for health in the Caribbean. Without human resources for health, we cannot have resilient health systems, and we cannot have improve health conditions of our population. Now, here's the matrix that was developed between all participants of the last meeting, PAHO CARICOM and the Regional Statistics Program. The matrix shows the priority areas that were identified and priority actions. I'm not going to go over each one of them, but I would like to highlight the ones that are considered priority, and they are the three ones highlighted in yellow. We do need a multidisciplinary national team in the countries. This is extremely important. Information systems is not just for information technology or information professional. It's important that at the highest possible level, we have ownership of information systems, and those in the decision position, policy position, can understand how important it is to have evidence and information at their hands related to human resources for health. And that's why it's very important to have these multidisciplinary national teams. Also, we need 3 national focal points that needs to be designated as the focal points for the National Health Workforce Accounts. So when we go through training, we can maximize the knowledge in the region. And if there is one person missing, or one person that it cannot attend to the meeting, or cannot fulfill the responsibilities of entering data, the other 2 can also do that. Also, related to rotation in our country, sometimes we have countries with high levels of rotations. When we have 2 or 3 people as focal points, it's a lot easier to transfer that knowledge and information and to continue with the work we've been doing in the region. The third item that it was defined as a priority was the training with the virtual campus of public health. Fiona mentioned that a little bit. And here I would like to emphasize as well, these are free resources available for the region, available to all of the countries. There are many very important courses there. It's self-paced. You can take whenever you can, and it's synchronous. So it's very helpful to set the base for many of the work we will be doing with the countries to help them achieve their major objectives. Thank you very much. And if you have any question, I will be happy to answer them.
Thank you, Giselle. I would like to ask, so this is the completion of the update from PAHO?
Correct.
Thank you so much for that. At this time, I would open the floor to some brief queries, if there are any. I would also like to acknowledge Ms. Lewis. She had previously raised your hand. I don't know if you'd like to open the mic and ask your question at this time.
Yeah, so the question I wanted to ask really was to, I think Fiona can help me answer, so I will speak with her personally on it. It had to do with the, why is Dominica, why we're not getting ahead in terms of the strengthening of the nursing education project at the Dominican State College in Dominica. So I want to know what are the challenges that we're experiencing, why we cannot have even the site visit conducted, and for us to get ahead with that project. That's what I wanted to ask.
Thank you so much, Ms. Lewis. So you will address it after with Ms. Fiona, or would you like her to comment at this time?
I am not sure if she wants to comment or if she wants to hold her response and she can talk to me privately. That's up to you.
Right. All right.
Thank you, Ms. Louise. May I go ahead, Chair?
Yes, you may. Yes, you may.
Okay. Ms. Louise, I will call you on that and we'll discuss it. Thank you.
Okay, no problem.
All right. So at this time, does anyone else have any questions or queries in relation to the updates offered by PAHO on the various topics that were mentioned?
Good morning. I'm looking for the hand raise sign on my computer. Somehow I'm not seeing it, but this is Mr. Edwards from Grenada. In relation to the national health accounts, some time ago, we had 2 officers at the Ministry of Health in Grenada who were trained to put in the data into the account, but those officers have since been relocated. One has retired, the other one has not been, she has been relocated to another ministry. So I'm looking at the possibility of having other officers at the Ministry of Health, Grenada, trained in the use of the National Health Workforce Account to put in the data on the different categories of workers. So I don't know if PAHO is able to share some light on how we can go about having other officers trained in that area. Thank you.
Thank you for the question. I'll extend the response to our PAHO colleagues.
Sure, I can go ahead and respond to that. Thank you very much, Ms. Edwards, for your question that I think it's very relevant to all of the countries. As I mentioned to you during the presentation, we see a lot of rotation in our countries, and this will continue to happen. So every time that someone leaves a focal point assigned by the ministry or assigned by the government to be the person in charge of working with us in the National Health Workforce Account and entering the data for the country, it would be ideal for the national authority to assign that responsibility to another person and let us know. What we do, we delete the account of the person that left and we include the new person with email and contact information and give that person access. So you can do that as whenever you're ready to assign the new person and send us the information for that new person for Grenada, and we'll be happy to update the system. You can do that through, I think, Fiona, and also our PAHO focal point for the region. And they will send the information to me and we will update that in the system.
Thank you for that response. I do have a quick follow-up. So that would extend, this procedure would extend to any member state or entity that wants to have the training done by PAHO.
Yes. And
Thank you.
but again, as I mentioned to you, like it would be ideal for all the countries to check who are their focal points. And if they have any of the focal points that have left, assign a new one and let us know who are the people. Also, if you have a hard time like in identifying who were the focal points, you can just list them and let us know who are the focal points for your country and send us their names and contact information, and we'll update in the system.
Thank you so much. I recognize Ms. Fiona has her hand raised. Could you please respond at this time? Fiona? I'm not sure if she's having some technical difficulties, so I acknowledge the raised hand and perhaps we can return once she's been able to respond to us. So are there any other questions on the update that has been provided by PAHO? If not, I do have one question.
Hi, sorry, Chair.
Yes.
I just got cut off a bit, so I missed a bit. I just wanted to add that we started off the action matrix with the past DPM Curvel, and the objective is to give support at the national level. So with Mrs. Edwards' question, I think that looking at it from a team approach where you have more than one focal point for the NHWA and you have a national team guiding the process of the implementation, this will help to ensure that we have continuity of the use of the NHWA platform. So I'm hoping that we get the support of the member states when we're doing the implementation so that we can avoid in the future some of these problems where we have the focal point being transferred or leaving the system and then we have to be changing, but we'd have it being led from a national point where a team is involved in it so we can do the updates as Dr. Almeida said, but at least there's continuity of the process. Thank you. You're muted, Dr. Bender.
My apologies. My apologies. So I was saying, if we don't have any other questions at this time in relation to this item, I would suggest we move on to the next item on the agenda, which would be the COSAD mandates from the RHR, which I shall provide from the Secretariat. And in so doing, I want to acknowledge that there was a 29th special COSAD held in April of this year. And with that, a report was presented on the migration of healthcare workers by the Pan American Health Organization to the delegates there, where the preliminary findings of the study were presented. And one of the major recognitions or things that were recognized coming out of that report was that there was a significant risk of continuous mobility and migration of nurses and physicians to some countries in the Caribbean. With that, the efforts of PAHO WHO in conducting the study within the countries of the Caribbean was recognized and commended. And coming out of that, it was an endorsement of the recommendations for the Caribbean to identify, systematize, share data on the human resources for health and to strengthen their HRH information system to support HRH planning as well as policy and decision-making regarding the mobility of health professionals. So with that, the Commission was mandated to support, with the support of PAHO WHO, to develop a policy brief to address the mobility of nurses and physicians with policy actions to be implemented in the countries and territories of the Caribbean. So that would be the actions, or rather the mandates that would have come out of the last COSAD as it relates to the HRH and this commission.
Okay.
So I don't know if there are any questions or clarifications at this time.
Dr. Bender, I think we just need to maybe get some feedback from PAHO since they will be leading on this initiative. And then
Okay.
you will invite discussion around the decision as guided by PAHO. They would be spearheading that. It was their presentation, so.
Thank you so much, Ms. Roy. And so with that, I extend to our PAHO colleagues to have any further updates or guidance or further information on this topic. Thank you.
I am trying to raise my hand, but I can't find it.
I'm not sure why that's happening. Let me quickly check to see if there's an issue. Go on.
Okay.
Go on, doctor.
Sorry. I do have a quick presentation on that if you want to see. It's the same presentation that I share with the COSAD and the CMO's meeting at PAHO. But I think the only, if you want a quick update, I can do that as well. It's up to you.
A quick update, please.
So the quick update, and just to build on what was said before, is that one of the major findings of our study which initiated with 19 countries of the Caribbean, and we ended up with 12, data from 12, is the need to strengthen information systems. And that's why I wanted to talk to you all about this, because it goes hand in hand with the National Health Workforce Accounts. So there is a lack of information about human resources in the Caribbean. And there are some countries that do not have established HRH information systems. And I think that's an agenda point for us from the PAHO technical unit to help the efforts to improve HRH information systems. Without the necessary information, there will not be evidence-informed policies that can assist the situation, minimize the situation of migration, improve retention of health professionals in the region, and or allow for HRH planning in the region. So I just want to strengthen that one of the major results of the study is the lack of information, the difficulty we had collecting information because of the lack of information systems. So I just wanted to emphasize that, and all of the other results, they were already mentioned there. Thank you.
Thank you so much. Thank you for the update. I just want to acknowledge the entry of Ms. Lizette Bell from Belize. Good morning, and thank you for joining us.
Hi, good morning. Thank you as well. Apologies for just joining, but I had an urgent meeting I needed to attend to. So thank you very much for continuing on with the meeting. Okay.
Thank you so much. And so I shall continue along with the agenda. So having received the COSAD mandates from the RHR and on our updates from our colleagues at PAHO, we can move on to the next item on the agenda, which is a provision of the status of the implementation of core health HRH indicators. I know that we mentioned in
Sorry, Dr. Bender, sorry for the interjection.
Yes,
I just wanted to ascertain whether our colleagues, the delegates, had any interventions on the way forward as it relates to the mandate. While PAHO provided the update with the decision, is there anything coming out from our member states, from organizations, as it relates to this policy decision? If none, then you can move, but I would just like to ascertain that we have some,
Okay.
I think I see some
I see
hands
two
up.
raised hands. I see Ms. Meeks and Dr. Puertas. So Ms. Meeks, can you go ahead, please?
Sure, thank you. I was just trying to clarify. So there is going to be a policy brief to be developed on the migration of physicians and nurses. Is that my understanding of what you had reported?
Yes, the mandate was that, yes, a policy brief to address the mobility of nurses and physicians be developed with the support of PAHO WHO.
Sure, and is there a time frame for the policy brief?
I believe we may have to open that to discussion at the moment, and within consultation with PAHO WHO.
Okay, so I assume that we will consider actions or anything further once the policy brief is in place. Is that correct?
Yes.
Okay, thank you.
I believe so. With that, I acknowledge Dr. Puertas.
Thank you very much. And I'm back again with you. Just wanted to make sure I understand where you are now, and I understand that you already discussed the new mandate from COSOT.
Yes.
And the mandate relates to the development of a policy brief on healthcare workers migration. Is that correct?
Yes, Dr. Puertas.
Okay. And I don't know if my colleagues were able to comment on PAHO's willingness to support identifying a consultant who could write a draft to be presented to the Commission in a similar way as we did with the previous two policy briefs. I don't know if that was already discussed.
No, and thank you for that. It's a timely entry because I
Thank
believe
you so much for that, Dr. Curtis. That is what I was looking forward to actually when I requested that PAHO, provided support, because a policy is not a policy until it is done. So I'm very, very pleased to hear that, and I must say that this is the normal from PAHO. They usually support this initiative. So I'm pleased to know that you have already decided to get a consultant.
No, very happy to mention this to Mr. Dr. Roger. And just as we speak, we already have some draft terms of reference that we will be sharing with you, so you can provide any feedback and input. And my suggestion would be that we follow a similar procedure as we did before. That is to identify the consultant. That's first thing. We have already draft terms of reference. And then we contract that person. Must be somebody with the experience in the Caribbean and in developing these policy actions, policy papers. And then we will have a first draft, and then we will present it to the Commission, as it was in the previous policy briefs. And then the delegates and participants to the HRH Caribbean Commission will be able to first receive the policy draft via email, and this is CARICOM would usually send the policy draft to the delegates and participants, so they will be able to comment in written. But then there will be also a presentation, not face-to-face, virtual presentation by the consultant and PAHO to the Caribbean Commission. And those who have sent the written comments, which I think it's important for all the delegates to do so, but we'll also be able to provide their comments during that meeting. The consultant will receive and systematize all these different comments, edits, suggestions for changes, and then we'll incorporate in a new version of the document that will be presented back again to everybody to approve. So that would be the procedure, unless there is any other suggestion from the group. Thank you, Anna.
I'm very, very pleased to hear that. Actually, we at the Secretariat, we have started developing a suite of recommendations emanating from our previous COSORD. So we would be happy once we receive the draft to make our own comments based on what member states have indicated. And I'm pleased that the group will have the opportunity to share their experiences and to contribute to the policy brief. Thank you very much for that.
You're most welcome. Sorry, I think I saw my colleague, Dr. Cecilia Cunha's hand. I don't know.
Yes, I did want to acknowledge her. She did raise her hand. Cecilia, do you want to speak at this time?
Yes, very shortly, because actually Dr. Porta said most of what I was going to mention. I was at fault because, yes, I was going to inform that we have already prepared a draft terms of reference for the consultancy on the migration of human resources for health. So as Dr. Benjamin Portas mentioned, we are ready to share these draft terms of reference with the Commission for their review, their comments and their additions to start the process. Thank you.
Well, thank you very much. Okay. All right. So I think that was any other comments in relation to the COSA mandate or any other updates? If not, then I would suggest we move on to the next item on the agenda, which would be the status of the implementation of the core HRH indicators. I think that would be presented by our partners at PAHO WHO. But I do want to ask, I know that Ms. Giselle did a presentation and she did mention some elements of it. I don't know if that there is an additional comment that would be made there. I see Ms. Fiona would like to speak. Fiona?
Yes, thank you, Chair. I just wanted to say that we've already discussed this item, and I would that we go on to the next item. Thank you.
Thank you so much. And so for the reminder for the group, I think coming out of the presentation that was provided by Giselle, she did indicate that they are almost in the complete stages of finalizing that report, which will be shared with us, or the document containing the core indicators that came out of the workshop, and that will be shared with us shortly. So I think, yes, that agenda item has been addressed. Thank you so much for that. With the next item on the agenda would be the update on the selection of the logo for the HRH Commission. And if you would allow me, I will quickly share what the logos looked like. Please let me know when you can see the screen.
Yes.
All right, so these are the two options that would have been put forward to the commission to consider for selection for the official logo that is to be used to represent the commission. To the right was option A, to the left. Well, to the left was option A and to the right was option B. Based on guidance that I've received, there was a circulation requesting that persons indicate which one they would have preferred, and it appears that option B was selected. I don't know if there is anything, Gita, if you'd like to add to this. Okay, so at this time, I don't know if anyone has any other comments or observations on the logo. Hello, Key. So I think just to confirm, it would have been option B. That would have been persons would have indicated that they would prefer. So Ms. Roy, I would ask for guidance on this at this time. Once that has been indicated, what would be the next steps? Would they have to be an official, any official action that has to be taken to make this the official logo?
Hello. Okay,
Yes,
yeah, but Dr. Bender, if that is the decision of the HRH, if that is the logo, I think what I recall is that the DPM, your predecessor, she had actually sent it out to member states. I am not aware if everyone, if all the members have signed on and agreed. I reviewed sometimes in the week and I was just looking at the responses and I did not see everybody responding. So maybe at this time, what we could do is to maybe resend to those, maybe you can follow up with Gita, look at the emails and those who have not responded. And once that is a decision of the commission, then we will be guided by what the commission decides and we'll take it from there.
Okay, thank you for that guidance, Ms. Roy. And so with that, I would propose at this time that we extend or at least circulate the options once more for the consideration of the commission. And I would propose that we perhaps make the final decision at the next meeting. I open the floor to whether persons concur with this. I see Ms. Bell has raised her hand. Go ahead, Ms. Bell.
Yes, thank you. I would recommend that if it is recirculated, that we give the members a very short time frame for them to respond, so that we can move on from the item. Similarly to, sorry that I am going back to the previous item, but regarding the terms of reference, similarly, when it is submitted by PAHO for us to review, I think we need to stick to the timeline so that we can proceed with the different interventions. Thank you.
Ms. Bell, thank you. Further to your intervention, are you saying that you all had agreed and that is the decision of the HRH that the second logo is chosen, or are you in agreement that we recirculate? You would know because you chaired the meetings.
Yes, in the previous meeting, B was agreed upon. So I am a little bit, I didn't know why this was on the agenda again.
Oh, so if it was agreed upon, okay. All right, so let us just consult our notes, our minutes of the meeting, and then we will maybe, before even thinking of resubmitting, if there's no need, then we will just send a communication to the
Thank you.
members. Okay? All right, thanks.
Thank you for the guidance. I also noticed that
Thank you, Chair.
Fiona.
And Dr.
Yes.
Bender, we will check with Miss David Covell. She
Yes.
would be in a position to say where we were exactly. Okay. Thanks.
Thank you so much. I did note that Fiona had raised her hand. I don't know if you still would like to speak.
Yes, thank you, Dr. Bender. I just wanted to indicate that we soon have publications that we would need to ensure that the logo is chosen very quickly. But since we're revisiting whether it's been circulated, I removed my hand. But if we're
Okay.
recirculating, we need a very short time frame.
No, I think based on the guidance of Ms. Roya and Ms. Bell, I think once we confirm that it was selected at the last meeting, the Secretariat will just circulate so you can start using it officially. But then we will consult with the previous DPM, Ms. Cavell and Ms. Bell. Thank you so much.
Thank you.
So I will stop sharing this at the moment. All right, so the next item on the agenda remains with the open discussion at this time for us to consider what we have discussed or updated on at this time if you would like to discuss on any of those matters in further detail. I open the floor. Dr. Puertas, I acknowledge your hand. Please go ahead.
Thank you very much. I just wanted to mention that PAHO's still in the process of bringing the new sub-regional advisor in human resources for health for the Caribbean. I've been taking and supporting the sub-region because of different reasons, including the fact that we got this very important catalytic fund for the Caribbean, which is going to be very strategic and very important, even to other regions in the Americas. So just to keep you updated about that process, that will take a couple of, hopefully not too long, but in the next, I would say, a few months, we'll have the new sub-regional advisor. So that would be very important because it will be the person who will be working together with Dr. Bender as well as the CARICOM in supporting the HRH Caribbean Commission directly. The other thing is, and if I may say, that I really want to emphasize the importance of participation of countries and delegates and participants in the Commission for many reasons. First of all, because I think that this is a way to really strengthen human resources for health in the Caribbean, and in a very much cost-effective way. And I think we should think about the strategies to enhance that participation. Okay. And again, I want to show my appreciation to those delegates and participants who are here now. But we are missing very important delegates. Recently, we had the WHA, the World Health Assembly, and the Caribbean was very well represented. And there were issues that were discussed, including the migration of healthcare workers in the Caribbean. And now you see that's one area that we're focusing on. So our national authorities, they are really pushing human resources for health as a priority in many countries of the region. PAHO is receiving not one, but several requests for technical cooperation in terms of human resources for health. We're working very in a very coordinated way with our collaborating centers. We have one here, which is the Dalhousie University, in supporting the development, updating of policy, national policy on human resources for health. We have the Bahamas that is establishing their own national HRH commission. So we have a lot of things happening in this area. So that needs to be reflected in the participation in this particular commission. And I have to say that I'm a bit worried that we are going to engage in this effort with WHO, which relates very much to a very strategic component and initiative, which is the America's Health Corps. And just we have to think that this is the Caribbean, the first region to be engaged in this. So we're going to have a lot of eyes, not only on the Caribbean, but directly on the HRH Caribbean Commission. So my suggestion is that we identify strategies to engage more participants. And I'm not talking additional members or delegates. I'm talking about those who have officially been delegated to be part of this commission. So, Madam Chair, I would suggest that we think about the strategies to bring those countries that are not participating and making sure that we have a cohesive and strong group when we need to start providing and delivering goods for the countries in terms of HRH. That would be my suggestion. Over to you.
Thank you, Dr. Portes. I acknowledge Lizette Bell. She has raised her hand. Please go ahead.
Yes, thank you very much, Dr. Portes, for that intervention. And definitely, that is also my concern. And I do support that we need to develop some form of strategy to engage the persons who are members of this commission. It is important for us to ensure that the commission is strengthened in order for us to achieve the goal we want to achieve, because we are all facing similar issues in HR in the Caribbean. What I would suggest, if the Secretariat would be able to share the members of the commission, and also, if I am not wrong, some of the delegates are members of also the RNB and yes, also the COSOD. So I would recommend that it be placed on the next RNB annual general meeting that is going to be in July as an item for discussion. I would be more than happy to present the item because definitely we need to engage our partners. And it also has to be done from the perspective of getting government's commitment. So there has to be some means of where we can engage at that level. And I think that the Secretariat can, just as we send for the other groups or the other, the RNB and the COSOD, when we have the commission meeting, we should probably use that same strategy to ensure that countries are represented and the right persons are represented at the commission. Thank you.
Thank you. Is there anyone else who would like to comment on this item? Okay. Well, I don't note anyone else, but I do want to agree that this is definitely something that we can look at adding to the RB meeting agenda. When we have our meeting to develop the agenda, the chair, we will certainly put it forward. Thank you. So I think just for the benefit of the persons, I see Dr. Puertas also has another comment. Go ahead, Dr. Puertas.
No, thank you very much to Ms. Bell for her suggestion, and I completely support that idea, especially considering that the regional nursing body is requesting support in certain very important issues, such as a new common curriculum for the midwifery in the Caribbean, and an examination similar to the one for the nurses, the RE&R. as well as the lab technicians. So there are many, many important elements that need to be addressed, in which the Commission should be an important partner, or even the main partner to implement some activities. So I don't know if perhaps sending a note to the Ministries of Health requesting their confirmation of who is the delegate to the Commission, in a very gentle way, reminding that we need their participation, would be some way, a strategy that could be implemented by CARICOM. On the other hand, PAHO, we could send notes to our PAHO country offices, just to remind them that this is something that we need to keep working on, and they can also talk to the delegates or national authorities to keep this going on. Those would be my suggestion. Thank you.
Thank you for those suggestions, Dr. Portas. At this time, I'd probably ask Ms. Bell if that is something you think we can work on coming out of this meeting.
Yes, definitely. I think we can certainly proceed in that direction.
Thank you so much. So
Thank
with
you.
that, I would put that down for action points. So I think before we had added to this open discussion, I had put forward an option to discuss what might be the now expanded agenda for the Commission, because if we consider the fact that the Commission has transitioned from an action task force that was developed coming out of COVID, and now that the COVID pandemic is no longer considered a public health emergency at this time, and we're transitioning more into a recovery stage, what now in its life as a commission, where we're not only focusing on COVID-19, may be there may be room for us to consider as a commission what might be the expanded role. So I wanted to put it out there for discussion, how we can then redefine or expand what we're currently looking at as a commission. We know for sure that we continue to look at migration. We still continue to work on the policy briefs that we have in existence on vaccination hesitancy and HRH strengthening, and the framework has been developed. So how do we then define what would be now possibly the expanded role of the commission, I suppose. I open the floor for that comment discussion. Ms. Bell.
Yes, thank you for the intervention. Human resource for health is an area where it's not only looking at issues of migration. There is also other issues that we have to take into consideration, such as quality, and meaning quality from both perspective of competencies and education perspective. So I would recommend that we not see the commission just limited to those few policy briefs that we have completed and we are going to complete, but we take the opportunity to have this collaborative commission to support member states in the challenging areas that, like mentioned before, the issues of harmonizing curriculums. So that that will give in result we have improved quality in our human resources within the Caribbean. So we have people who are properly trained. So it's looking at that. And this commission also will play a critical role when we start to see the implementation of the project through the Pan American Health Organization, as Dr. Wright mentioned before, the America's Health Corps. So I think the commission will continue to function as a regional initiative to support member states in the expanded role of human resource for health. So looking at both practice, looking at education, looking at competency, and how HRH will help us or contribute to countries achieving the SDGs, and even countries being able to achieve some closer point to universal access to health and universal coverage. So from my perspective, I think it's an initiative that needs to continue. It needs to be strengthened, and it plays a critical role in the health sector from a regional perspective. It's an avenue for member states also to express challenges that they are facing, and to also exchange ideas for what some countries are doing that are working for them, that we can have some exchanges as well for improvement. Thank you.
Thank you for that, Ms. Bell. I see Giselle has raised her hand.
Thank you very much. I just would like to emphasize what I mentioned before and recommend that one of the actions that could move forward with the Commission is the development and strengthening of human resources for health information systems. And PAHO can provide a lot of support on that. We mentioned the last time that there are a number of actions that can take place to support HRH information system in the region. One of them is understanding the maturity level of information systems in each country. I know that some of the countries in the region has participated in some maturity exercise for overall health information systems, but we also need to do one specific for human resources. And because human resources for health information system is a little bit different, because as I mentioned before, information from that comes from other sectors as well, from the education sector, from the labor sector, from the finance sector. So one of the things that we can continue to do, and it would be an excellent agenda item for the Commission, is development and improvement of health information systems with maturity of exercises of maturity of health information systems, also mapping of actors for human resources for health information systems. This is also very important. And also mapping of professionals in the region, so we can understand how is the region makeup of health professionals, and also the strengthening and improving the use of national health workforce accounts. Thank you.
Thank you for that, Giselle. So I acknowledge Cecilia. Cecilia has raised her hand. Go ahead, Cecilia.
Yes, thank you. Very brief. I would like to also emphasize something that has been mentioned, but I think that it would be very important for the Commission to also have as a working topic the homologation of curricula among countries. One of the problems we had during the worst of the COVID-19 pandemic was that every time a Caribbean country asked urgently for an emergency medical team to come into the country, and for example, in Grenada, we had this problem. We had to convalidate almost there the abilities of and the competencies of the teams that we were bringing into the country. Luckily, we didn't have any problem with that because all the emergency medical teams were already validated by their respective countries and were from countries like Spain, the US, etc. But this is something we need to take into account. This is something that will be instrumental and fundamental as the development of the American Health Corps. If we want to have human resources for health workforce prepared to go to other countries to help in any serious outbreak. And also, if we want to have the support of other emergency medical teams coming into our countries when we need them. So the working on the homologation of the curricula, at least for facing emergencies, health emergencies, it is of utmost importance for advancing the agenda of having resilient health systems. So I would suggest that this would be also a topic for the Caribbean Commission to discuss and work on it. Of course, we commit our support to work on this topic as well. Thank you.
Thank you, Cecilia. I think this is a very timely topic. So just to round up what we have discussed so far, I think one observation has been that we do need to focus on strengthening our information systems as it relates to RHR. We also did look at how we can harmonize the training curricula. And as to that last point, I know that the R&B, the regional nursing body, would have indicated they wanted some assistance in harmonizing the curricula for midwifery. So I think we have a point of entry there where we could definitely consider if there are other areas very quickly that we can look at how those curricula can be harmonized. So thank you for that. So I think that any other comments on this particular discussion item? Dr. Puertas?
Thank you very much. I'm really interested in listening to different options, and I agree with them. I think they are very important for the Commission to support and work with. I would mention that the original terms of reference of the Commission, the task force initially and then the Commission, included a component on policy development, and supporting national policy on HRH. So that's something that should be continued. That's something that was stated from day one, and that's something that should continue. What was not so specific in those terms of reference were this component of capacity building. And I think it's going to be important to include it because, again, now we have all these different initiatives regarding these elements. And by the way, we have done some very important work as a Commission with support from PAHO in terms of developing some training programs, including with the UI, for example, the diploma and certificate in health policy and health systems, that it's still in progress. And also some specific courses developed by the Virtual Campus for Public Health. So that's something that we need to continue supporting from the Commission, especially now that we have this initiative and funding, specific funding coming to support this initiative on capacity building in the region. So that's something I would like to add. Thank you.
Thank you, Dr. Puertas. Fiona? I acknowledge Fiona and then Ms. Bell.
Yes, thank you, Dr. Bender. As Dr. Portas just brought up the virtual campus, I would like to see more proposals coming from the Caribbean, and particularly the courses that we have on the virtual campus are regional courses. They have been translated from other settings, and what I would like to see is that we develop or modify some that we can use within the Caribbean, and we actually start to use these courses because it's a free resource. A lot of work goes into it. It's up-to-date courses, and we want to continue to promote it and promote the use of the courses that are specific to the Caribbean region for different challenges that the Caribbean region faces. So I just want to piggyback on what Dr. Puertas said and just encourage us to put forth more proposals, particularly from the Commission, as to what courses we can develop, and so we can give some support in capacity building. Thank you.
Thank you, Fiona. So Ms. Bell, go ahead.
Thank you, Dr. Menda. This question is probably for Dr. Puertas with regards to the timeline for the the training and capacity building through the America's Health Corps. When are we expecting to see that countries will be engaged and the type of programs that will be available?
Dr. Puertas?
Yes, thank you very much, Ms. Bell. And what we're going to see now is that there will be the funding to carry out different activities. The first one that we identified with our colleagues from the WHO has to do with a mapping of training and academic programs in the region, which we already started. So that's something very important that we need to complement. We, as PAHO, did this, and then we got some very important feedback from the members of the commission, task force then. And that's going to be one of the publications we were talking about. So what Fiona was mentioning is going to be important too, to identify those courses that the Caribbean consider important for the development of their health systems, for preparedness for future emergencies. And so what we need to see now, it's the future, what the mapping updated, but we need to see in the future what are the short, middle, and long term the Caribbean needs in terms of training. So the first steps are going to be around identifying those courses. We need to move with Guyana, for example. They have this virtual nursing program, and they are very interested to incorporate participants from other Caribbean countries. We need to engage in identifying these common curriculums for, in this case, midwifery, laboratory technicians. The R&D and PAHO, we talked in the past of evaluating the curriculum for nursing education and updating it, as well as to assess the RE&R, because they need to be, it has been a while since they were developed, and it's time for them to be adjusted. So those are some elements that we need to bring into the attention. And now that we will have some funding to carry on this, that will be very important to do so. Something that also some countries, I remember in the Caribbean, were very interested is in to do and to carry out health labor market analysis. And as you will remember, we had the expert from the WHO talking about them, since countries like, well, it doesn't come to my mind at the moment, but they were interested in having this analysis of a health labor market, because that will provide a different perspective and information that, for decision making in the countries. So those are some of the elements that we need to identify. My plan is to have a plan and budget for the next 6 months that I will share with you, of course, in how this first tranche of funding is going to be allocated according to these main elements that we have been discussing now. So that would be the first stage.
Thank you very much, Dr. Puertas.
So thank you both. I see we have approximately 12 minutes left on our meeting time. So I think it might be prudent for us to move on to the next item on the agenda, which would be any other business. Do we have any other business to present on the floor? I'll open the floor to you. Okay, so if there's no other business, then I would suggest to move on to our next item, which would be setting the date for the next meeting. Okay, so I would need some guidance on this. How do we set the date for the next meeting? Do we make a proposal and have persons state when possibly, or is it a mandated particular date of the month or quarter?
Go ahead, Ms. Bell.
Dr. Bender, I'm not too sure. I think it's every quarter. If
Okay, so it's the second Wednesday every 3 months from now, every quarter. So it would be in September 13th.
September 13th. So we're pushing forward September 13th as the date for the next meeting. Are we going to keep it at the same time? I think the meeting was set for 10 a.m. today.
Yes, that's correct.
Yes.
If I may add something just to keep into consideration the possibility of having an additional meeting before, because again, by September 2023, we should have already established and have some activities in progress that may need the attention of the commission. So I'm just requesting the possibility of having an earlier meeting if the need comes to appear. So that would be my suggestion.
Okay. That suggestion is noted, Ms. Bell. I don't know if you want to
Dr.
comment on your
Bender,
thoughts.
what is the date we're looking at?
The 13th of September.
Huh?
My apologies, Director. So the next meeting would be on the 13th of September, which is the next quarterly meeting. However, Dr. Portas is asking that the Commission considers having an earlier meeting to provide updates on items that PAHO expects to shortly conclude for sharing.
Okay, I also have a concern there too, because we will be having the next COSOD in Washington, September. We are not too sure yet as to the date, but it is usually either between the second or third week in September. So maybe we would have to look at our calendar and just keep the date in mind, and then we can revert.
Okay, thank you for that, Director. So it's being stated that we should have this as a tentative date in consideration of the COSA that would be held in September. So following confirmation of the date of the upcoming COSA, then we may have to revisit the date of the next commission meeting. So
this being said, since that was a mandate, it would be nice that we would be able to provide the COSA with an update. That's what I'm thinking. We should try to have this meeting before the COSA.
I think Dr. Portas was proposing that. So Ms. Bell, I see you have your hand raised.
Yes, I agree that we should have a meeting before because based on this meeting, Dr. Portas and Ms. Ancona mentioned they already have a draft terms of reference to share. So while the commission is working, definitely we will have some decision making that needs to be taken outside of emails. And so I do agree that we should have consideration for an earlier meeting.
Okay, do we have any proposals on when that meeting could be? Could we consider the prior month, or do you want to consider the month of July? But considering that the month of July, we do have the regional nurses body meeting. So if it is in July, it would have to be in the latter half of July, or rather the earlier half. July.
Yeah, the end of July.
Yeah, the end of July. So it would be either for July or August. Perhaps persons may be freer in August. So I want to propose August. Would we have a tentative date that we might want to consider? Maybe the second Wednesday in August to keep in line with what we currently use.
That's fine. I would recommend that.
Okay, so the proposal has come forward that we have our next meeting outside of the quarterly meeting on the 9th of August, which is the second Wednesday. Would we propose at the same time, 10 a.m.? Okay, fantastic. So are we in agreement?
Yes, 10 a.m. is fine.
Okay, so our next meeting will be on August 9th, 2023 at 10 a.m. So we'll take note of that for the record. Thank you. So with that, we conclude our meeting. At this time, I would like to thank all of you for taking the time out to join the meeting and for your very active participation. And I also, again, want to acknowledge our chair. So I think, and chair, I'm hoping that following this meeting, I can have a meeting with you separately. Both to advise on what would have been discussed before the meeting and to get myself au fait with what has been the work up to this point from your perspective. So thank you so much. Dr. Porteous, I don't know if you have any closing comments.
No, just thank you very much. And I don't know if we had the time to give the most warm welcome to Dr. Serena Bender. So I think we're very happy to have her. And I'm sure, we just wish you the best success in your new responsibilities. And as PAHO, we will be very, very happy to work with you.
Okay, thank you. Ms. Roy, I don't know if you have any closing comments at this time.
Okay, like Dr. Porteous, just want to say thank you very much to all our delegates and PAHO and all our delegates for what I would consider a very fruitful meeting. And I also want to thank you, the PM, for having done an excellent job. That's your first meeting. The meeting was executed very professionally, and I am not wrong when I said before that you're new maybe to the program, but not new to this activity. So you did a wonderful job, and thank you for that.
Thank you,
wishing
Director.
everyone all the best.
Yes, and on that note, I wish everyone a happy rest of the day and until our next meeting. Thank you so much.
Thank you.
Thank you very much.
Thank you.
Thank
Goodbye,
you.
everyone.
Goodbye.
Bye-bye.
Bye, everyone. Bye,
Bye-bye.
Nurse Louise, Fiona. Bye.
Bye, Mrs. Roy.
Esther.
Dr.